There we go.
Hello and welcome to another installment of the Self-Care as Medicine Summit. Today I am beyond excited to introduce you to Dr. Charley Cropley. Thanks so much for being here.
My joy. Thank you for having me.
Part of the reason I asked Dr. Cropley to join us is because not only does he have over 30 years in naturopathic medicine, but he really has evolved his practice to being focused on what he calls behavioral medicine or naturopathic behavioral medicine. And at this point in his career, he uses no physical medicines. The medicine is all self-care, self-healing, and self-exploration. And so I thought, who better than to have on the summit besides Dr. Cropley, so that we could really learn from his well of wisdom as he's evolved over the years and really honed in this idea of self-care. And so really his primary mission at this point is to teach self-healing for not only his patients and lay people, but also for us professionals, because we don't often do a good job of doing the self-care and self-healing first. So thank you so much for being with us. So I wanted to jump in and just, you describe illness as being wise and purposeful. And I think a lot of people who come into most doctors' offices are not feeling that way. That, most of us care to get rid of whatever is going on. So can you share a little bit more about this very different paradigm?
Yeah. This is the essential difference between conventional medicine and naturopathic medicine. The difference that as naturopathic doctors, we understand that medicine is wise and purposeful. As an example of that, if you have a hangover, and a hangover is the result of having poisoned our bodies with alcohol. And the hangover is the cure for alcohol poisoning. Similarly, a cold, a bronchitis, a diarrhea is the cure for something. And a skilled naturopathic doctor understands where to look for the behavior that is causing this illness. And throughout the work of naturopathic behavioral medicine, we look at illness from the get-go as something uncomfortable, perhaps painful.
We froze for a moment here. We both are having weather stuff at our homes today, so our internet has been a little bit wonky. So I'm just going to pause for a moment till he comes back online. Okay, so here we are back. Sorry about that technological pause. So go ahead with what you were saying about it being the cure, these acute illnesses.
Yes. Did you hear me speak of hangovers?
Yes. Yeah. So we kind of jumped out around colds and bronchitis.
Okay. Similarly, colds, bronchitis, diarrheas, fevers are our body's wise and purposeful attempts to heal us of other, perhaps less obvious, self-harming activities. So we may not be getting rest, we may not be getting exercise, we may be drinking too much wine and coffee, and therefore we get a cold or a fever.
Okay. Well, what about more chronic illnesses like heart disease or diabetes or chronic knee pain or something like that?
Yeah, that's a great question. And that's what I work with primarily, is chronic degenerative disease.
Okay.
Chronic degenerative disease is the result of the misunderstanding of acute disease. Acute disease is self-limiting illness that I just mentioned, like colds, fevers, diarrheas. When you don't understand those and you think that something is wrong with the body and that it has a cold that happened because of external influences, because of viruses or bacteria. When you make that interpretation and then work to use medicines or surgeries to suppress the cold or the whatever the acute illness is, when you suppress it, what happens is two things. One is the suppressive agent, the medicine, is itself toxic to the body and poisons the body. Secondly, you have failed to discover, for example, that smoking or eating food allergies is contributing to your illness. You have not found the cause. So the cause continues, and meanwhile, your body is poisoned and weakened by having taken the toxic medication. And so when you go through your life repeatedly suppressing your body's efforts to heal herself, what happens is that the illnesses develop into chronic illnesses being the type of illness that we have with us all the time, like diabetes or rheumatoid arthritis.
Mm-hmm. Mm-hmm. Okay. All right. So it's really when we're taking these medicines, these acute medicines to move us away from our symptom picture, we're really repressing what our body is trying to do to bring us back into homeostasis.
Generally speaking, yes. There is a place for medicines, which naturopathic doctors well understand. What is all important is that if you understand what the body is doing, then you can work in harmony with the body, even using medications.
Okay. Okay. So really understanding that the body does have its own wisdom, and that when we have symptoms, either acute or chronic, that there's a bigger story being told here.
Yes, exactly.
Okay.
By observing, it's obvious that the body has its wisdom, right? It's warming itself, cooling itself, defending itself, digesting, the heart is beating. It's a living miracle. That is obvious. And what is then to be recognized or embraced is how to befriend that wisdom and how to listen to it, not just when our body has had to resort to illness to get our attention, but listening to the messages of our body that's the greatest art, our body and our mind. Mm-hmm.
Yeah. What do you think gets in the way of us listening? Because I see this not only in the people that I work with, but also myself, where I'll kind of hear that gentle whisper and steamroll it with my mind's agenda. So yeah. What's going on? Yeah. Why aren't we listening anymore?
Naturopathic medicine points to two reasons. One is that we're ignorant, which we just discussed. People do not understand. They are ignorant of the truth that their body's illness is its only means of healing itself, right? So we're ignorant of that. And so then we take counterproductive measures. The second reason that we don't change or that we don't listen is a lack of passion or misdirected passion, say desire. So we could be more invested in and caring about cigarettes or TV than we are caring for our body.
Mm-hmm. Okay.
Mm-hmm. Yep. So the work that I do, the work that we all do, whether we know it or not, the central work is building passion for health and building understanding of how health is produced. Mm-hmm. And passion for health is inherent. Illness awakens passion for health and the desire to understand because we suffer and we don't like suffering.
Right. Yeah.
Yep.
Yeah. I haven't heard it phrased that way. This idea that illness awakens a passion for health. That's really I mean, I see it all the time, but I haven't heard it articulated like that. That really resonates for me.
Yes, and you can see that medicine, conventional medicine, I'm saying, gives the patient very little opportunity or encouragement to express the passion that the illness has awakened in them to be healthy. In a naturopathic physician or in any physician teacher, we use that and point to the patient and instruct them that their illness is speaking to them about their behavior, that somehow in ways known or unknown, they are harming themselves.
Okay.
And that the illness, I invite my patients to look at 4 behaviors. One is the ways they eat. The second is the ways that they move their body, exercise and rest. The third is the ways that they use their mind, that we speak to ourselves internally, the emotions that we frequent and may be addicted to. And the fourth behavior that our body is speaking to us about is the quality of our relationships. How stressed are we in, or how nourished are we in our marriage, with our families, and with our work, which is also a means of our relating to others and our world.
So would you say that then your behaviors are part of what causes illness to manifest?
That's a good question. Yeah, the answer is an absolute yes. Okay. There are a variety of causes of illness. Genetics is a cause, infectious agents are a cause, and the infectious agents, the environment and environmental poisonings and damage is a cause. And I maintain that the greatest cause and the greatest power for healing is our behavior. And further, that our behavior is really the only thing that we have control over. And it is astonishing, the power of our behavior. And I would assume that everybody listening has an experience of having changed the way you eat and seeing how powerfully it influences your health and well-being. Or you have begun an exercise program or experienced what it's like when you get good sleep or don't get good sleep. And I think I hardly need to say how wonderful it would be and how markedly it would influence all of our health if we could love ourselves more and be less critical of ourselves.
Absolutely. Yeah. Well, and I think sometimes when I offer that to people, or even sometimes when I receive it myself, it's this idea of like, oh, so I'm causing this. This is my fault. So how would you respond to that?
It's a conversation that is essential to have with patients. And if you want power with illness, that is, if you want to be able to influence your health through your behavior, it requires assuming that your behavior makes a difference, right? That's just a given.
Yeah.
And if your behavior makes a difference, then your behavior you can use to heal yourself, as well as your behavior is causative in your illness. There's no escaping that. The real question is this, and the distinction is that I make with patients is that I'm not saying that you are bad, nor am I judging you for what you've done. I do the same things myself. Our harm to ourselves is we're always harming ourselves. And so then it's an opportunity to ask ourselves, or to ask my patient in this case, does she feel judged? And does she judge herself because she has, if she assumes that she has contributed to her illness? And that judgment, right? So we'll stop there, but it's a very fertile conversation that leads into self-judgment.
Oh yeah. Well, it's everything. And I see that, with this idea of, if we do a dietary change, or, make a suggestion that they're not able to follow through with, it's a very harsh self-judgment around, I'm just not disciplined enough. I don't have enough willpower. So what would you, do you feel like self-discipline is required to make positive health changes?
I would use a different term. I personally love the term self-discipline and self-control, but they convey, or can convey to people, a punitive, critical, judgmental approach. And let's see. Excuse me. And but the question that you're raising is this issue of self-control, or what I call wise self-governance, is the million-dollar question, and the missing link, not just in medicine, but in human life. In medicine, it is the missing link because, as you have so well conveyed from your own experience, it is very common that when you suggest a beneficial behavioral change to a patient, improving their eating or getting exercise, that they face not being able to make that change, right? And for most patients, as you described, they judge themselves, they feel ashamed of themselves, and feel that it's hopeless for them to be able to make these changes. That's so.
Yeah. So then,
and I offer a whole methodology directed exactly to that.
Okay. So that is a big barrier potentially, is someone just really kind of getting into that place of self-judgment and feeling like they don't have what it takes to make these changes or stick to them. Maybe they can do it for 30 days, but kind of committing long term is like, this is just how I choose to nourish myself or take care of myself. Other things start creeping back in.
Yes, exactly. That is the problem, is the challenge, being able to find the power to make these changes and the power to sustain them, which, as I said before, the power to do this is passion, is self-love. That is inherent in the illness. It is the illness and the other sufferings in our life that when we look at them closely and say, these are the results of my behavior, these are linked to my behavior, our passion to change our behavior goes way up. Many people are passionate and lack the other element, which is the understanding, in this case, of how do I get myself to make these behavioral changes. And I would love to discuss that with you, Nicola.
That would be great. Yeah, I think I'm waiting with bated breath. I'm like, great. Yes, I've got these old habits, and how do I change them? Because I've read books and listened to talks and, you know, all that sort of stuff. But there, even in my own world, there's some pieces that I keep coming back to that I'm like really get frustrated with myself around.
Yes, thank you for saying that. And I the same. We're all human beings, and we are all faced with this exact challenge of governing our behavior. And I fail at it every day. Right? And
like, what do you mean by that? Because I think we have this belief that once you're the expert in something, that means that you've mastered it.
Mm-hmm. So you could liken it to music, I suppose, the work of mastering our own selves. I have a degree of mastery that I cherish and that has grown over the years and is much greater than what it was when I was a younger man. Mm-hmm. And like music, there's no end to this art. And the more that we learn to take care of ourselves, the more our passion to take care of ourselves grows and our desire to understand.
Okay.
Yeah.
So how do we get started? I mean, how do we, because I think a lot of us do carry some pretty harsh judgments and criticisms of ourselves, you know, that we don't deserve to be better taken care of, or we don't deserve to take care of ourselves first. And then on the flip side, if we do, then we're selfish, or we're not showing up for somebody else the way we should be. And then if we try and we fail, then, well, you couldn't do it and you don't have the willpower. I mean, so it just feels like there's a negative conclusion no matter which path we choose.
Mm. It feels like a negative conclusion because we either berate ourselves or we give up. Were those the two choices?
Yeah, it feels like, yeah, or we never even try in the first place because, you know, somebody else, you know, I had this happen this morning. I had reconnected with a patient of mine last week who I hadn't seen in a long time, and she's like, okay, I'm ready, and this and this happened, and I heard what you said, and I'm ready to do it, and let's meet weekly to be accountable. And I was like, okay, let's do that for a small period of time. And then I just got a text from her this morning. Oh, my daughter's sick. Her daughter's 21. And today's Monday and her appointment's Wednesday. So I need to cancel my Wednesday appointment. So it's her first one and she's already canceling, you know, after we've had this whole conversation around like, okay, are you ready for more of you? So that's, I think, maybe what's in my mind is that maybe we each just self-sabotage or derail ourselves before we even allow ourselves to check it out.
Yeah. Yeah. And we have a lifetime of doing that. Otherwise, we would have achieved many of the things that we want to achieve. And this sabotage is one of the reasons. I'd like to have the idea that we could walk through several of the teachings in the course. Yeah. That is exactly how I address this. So I see that in my patient, but I don't start there with them. I begin, as we're beginning in the first session of the course tonight, with a therapeutic conversation about what they really want and about desire and fear. And what we really want, all of us human beings, is we want a pleasant life. We want to be healthy in our body, in our mind, and in our relationships. That's our longing. So if our body feels good, and a healthy mind is a happy mind, and our mind is happy, cheerful, at peace, and in our relationships, we feel connected, we feel the flow of love, and we feel understood, and that we understand. If we have those, we're good, right?
Sure.
But very few of us, that's what we want most. And when we lose our health in those areas, that is suffering. And what we don't want is suffering. We don't want bleeding bowel movements and the inability to breathe and to live with shame and self-criticism and anxiety and depression. And we don't want to have divorces and fights with our parents and misunderstandings at work.
Sure.
We don't want those things.
Sure.
This is, and that is, and so we recognize for ourselves that how precious to us health is, or healing is, and how horrible to us suffering is. And that at our core, this is what we all want. Then understanding this and how much this means to us, then we can embark on a program to fulfill that. In this case, we're focusing on, as doctors, we focus on suffering of usually in the form of illness. So then the first exercise I give my patients, I have this conversation with them so that they see they want this above everything else. That if they get money and if they get whatever, fame, to travel, all kinds, the other things that we may want, but we lose our health, that we have lost what is most precious to us. With that in mind, then, we do an exercise in which I ask them to clarify for themselves, what is it that you desire in your physical body, your mental, emotional body, and your social body? What is it that you desire there? And see if you can continue to understand what are your strongest desires. And then the other part of the exercise is to ask yourself, what is the suffering that you are trying to avoid? What is it that you desire not happen to you in each of your bodies? And then the second part of the exercise is to ask, what is it that you desire, the behavior that you desire in your eating, your movement, your thinking, and your relating? What is the behavior that you desire? And what is it that the behavior that you fear or desire to not do?
Sure. Okay.
Right?
Yeah.
And then you see the patient is working with her own desire and her own fear, which are her greatest motivations in all of life. That is what she really wants and what she really doesn't want to happen. And then I can sit with her and say, okay, now let me show you how to implement this.
Okay.
Right?
Great. Yeah. I mean, I think that's such a great starting place for anybody who's listening. Go ahead and, write those questions down and spend some time journaling or just internally reflecting. And because I think that's the big why that most of us either don't know or don't connect into or avoid, because we don't really want to lose.
Yes. Mm-hmm. It's the most real way that our life speaks to us, is through what we want and what we fear. That shapes, then we're on the lookout for things that serve that end. And we see the world that way. We see it as, this is an opportunity, this is an opportunity, this is what I'm looking for. And the things that don't concern us, literally don't concern us and don't appear to us in the world. Mm-hmm. Mm-hmm. And so here we are beginning to give back to our patients, or guide our patients to find the power inherent in their illness. Right? We make their illness meaningful to them. Your illness is your ally, is your friend. Yes, harsh friend, bitter friend. Mm-hmm. But your ally in making your life more meaningful. What is your life if it's not your behavior and your relationship, right? Mm-hmm. Yeah. And our life, our eating, our movements become more meaningful to us. They're important. My well-being depends on these. And that's people really appreciate that.
Yeah, I mean, that's huge. That's a total flip upside down of the paradigm, which is I'm a victim to what's happening to me, and I hate what's happening to me, and there's nothing I can do.
Exactly. Yes. People are empowered. Yeah.
And even if I'm working with a provider, I'm not passing the power over to that provider to fix me. I'm going to take control, because the behavior is the thing I have control over, and I can absolutely change those things.
Yes.
That's a very different perspective than most of us in this country experience.
Yeah.
Yeah. Mm-hmm. Yeah. I mean, I feel lighter even, hearing that, like, yeah, of course. And I think it makes sense, but I don't think it's spoken, and I don't think that's the underlying message that most of us receive. I think most of us are receiving that I'm broken and I need to be fixed, and I need someone outside of myself to do that.
Yes. Mm-hmm. And we definitely do need teachers.
Absolutely.
Yeah. And now we can see that we've drawn the link between illness and our behaviors, and we now return to the question of how do we master our behaviors. Mm-hmm. And this inquiry, the way that we master our behaviors, or better said, master ourselves, is again through growing in passion or in love for ourselves. We come to love ourselves more, and we come to understand ourselves more. Okay. Understanding is power. Love is power. That is how we heal our behaviors. We have already, in the first step of clarifying what we most desire and what we most fear, we have grown in understanding of ourselves. Right? We understand ourselves better, and that understanding acts. As we see how much this means to us, and we understand how much our health means to us, how strongly and truly we desire to be healthier. And we understand our fear of suffering, that understanding is power. That changes our behaviors, doing that alone. And then we're now looking, so that gives us power to change right there. And now we are examining where more does self-control come from, right? And how do we become more skillful? And so our passion to be more skillful leads us in the course. We speak about that we have an immunity to change, and that we are all at war within ourselves. We want to heal our diabetes, and we want to eat sweets.
Right.
We want to have a more fit body, and we also want to stay in bed in the morning and not get up and work out, or we want to lay on the couch and watch TV. We are conflicted in our desires. And the means that most of us use for healing this conflict is, we identify with the side of ourselves, some of us, with the side of ourselves that wants to eat better. And I just don't understand why I can't eat better. And there is a side to ourselves that resists eating better, to whom eating better does not sound exciting. Stopping coffee, stopping wine, eating more vegetables, these things sound terrible to one side of us,
sure,
who is frightened of these changes and has real reasons that she doesn't want to make them. However, most patients have not learned to listen to that side. That side of ourselves, our shadow, we treat like disease. We marginalize her. She gets no voice with us. And being suppressed, then, well, we cannot suppress. It isn't successful. And so what happens is that rises back with greater strength in us. Mm-hmm. And so a great part of the course is learning to befriend and to seek to understand both these parts of ourselves, both the one that desires health and the one that resists health.
Yeah, yeah. Well, I know,
and to do so without making one wrong and bad.
Well, and that's where I was just about to go, is this idea of having this dialogue with kindness. You know, that there's room for this point of view and this point of view, even though they seem diametrically opposed. And that's something you and I have talked about before, this idea of just asking your body, does this feel kind? You know, does it feel kind to have, you know, a couple of chocolate bars before bed? And it's like, well, when you put it that way, not really. And it's like, okay, so now we're moving out of, you know, you should do this thing, because I think this is another thing I see often in the people I work with, is this idea that when they're given a health directive or invitation to, let's say, get rid of gluten or something like that, or get rid of flour, and it's like, I'm going to hammer myself into doing this thing. There's no kindness there. You know, it's another form of self-harm with a healthy, like, wash over it, but it's not really getting to what we're talking about here.
Beautiful, beautiful. Yes, that's exactly right. It's another form of self-harm, and I'm aware and teach to my patients that you have come to see me because of your love for yourself. because of your sincere desire to not suffer and to experience greater health and happiness, to heal your illness. That's the essence of caring. And you cannot bring about this good that you desire. You can't bring about something kind and caring and loving by being mean to yourself. It doesn't work. Actually, better said, like a suppressive medication, a toxic medication, it will bring about short-term benefits, or can bring about short-term benefits. You can get yourself to do certain things for short periods of time, but it strengthens your dependency, your belief in, and your trust in self-criticism.
Yeah, well said.
Right?
Yeah. And I think anybody who's listening today, I mean, the same would apply to you, I mean, can you be reflective on some of these health behaviors that you're taking on or think you should be doing, and look at them through this lens, and how different does that feel to say, actually going to bed earlier and waking up earlier feels amazing to me. I feel so much better when I do that. I hear this all the time. Well, I feel so much better when I do X, Y, and Z, but A, B, and C gets in the way. And it's like, wait a minute, where are you in that conversation?
That's exactly right. Where are you? And who are you in that conversation?
Yeah.
We must go back and see that, find the root that we began from, which is our desire to care for ourselves. Right? That caring root is what has us engaged in this challenge of changing our behavior. And this is everything in my methodology of governing our behavior wisely. Everything is being kind to ourselves. And I give people two qualities of ways to do this. One is the obvious ways of, I'm going to face the challenge of regulating the amount of wine that I drink or the amount of TV that I watch. And we take on those challenges. And so in each of the four behaviors, in eating, movement, thinking, and relating, there are practices that one can set aside, just like a yoga practice that you practice every day. So in a day, you're practicing eating less sweet. In a day, you are practicing doing 15 minutes of yoga. In a day, you are perhaps journaling or meditating for a period of time. These are set practices. And these require time, and these, that is, they require time in your day to do these things. And that's a tremendous challenge for people. And that's one type of practice that I call focused practices. The second type of practice is what I call spontaneous practices. And spontaneous practices generate time and generate vitality and energy. And an example of a spontaneous practice is breathing. In this moment, we are each able to bring our attention to our breath. And we can use our breath as an expression of our caring for ourselves. And we can do this together and feel immediately, this is calming, this is energizing, right? Now, breathing is one example. Our posture is an example. The way in which we speak to ourselves internally is an example. We can make our posture, our breathing, and the way we talk to ourselves expressions of our kindness. This requires no time and is immediately healing to us. By doing these, we directly experience the power of being kind to ourselves. And our confidence in this grows. And by doing the spontaneous practices, we grow in the power of love, of self-love, that enables us to then change our wine drinking or our TV watching. And I will add, I teach my patients to practice, to use spontaneous practices while they are drinking too much wine and while they are watching too much TV and chattering at themselves about it. In that moment, we can breathe and say to ourselves, Charley, feel right now my kindness for you, my love for you, and my respect for you. Whether you drink wine or don't drink wine, I love you. Right? That's how we heal wine drinking.
I've always wondered. Perfect. But I think what you bring there is so true, though, because it's not about the wine or not the wine. It's not about the wine. It's about why we're drinking the wine and how we're drinking the wine and how much we choose to drink the wine because we're not paying attention or we are paying attention and realizing, I love the wine because I love the taste of wine, or I love sharing a bottle of wine with friends, or it reminds me of my trip to California or whatever, and connect in with that energy. And then we need less of the thing to fill our cup up rather than needing to fill our actual wine glass up 4 times in order to feel filled. So if you're sitting here being able to say, I love you, whether or not you drink the wine, then it feels like the antidote for that part that's like, you're not supposed to be drinking wine. I can't believe you're drinking wine again. That whole thing.
Yes. Yeah. We experience our power over our own selves, meaning, in this case, perhaps what we fear most about drinking too much wine is how we withdraw our love, criticize ourselves, right, and shame ourselves for it. That's an attack on what I'll say our very soul, our essence. And that hurts far more than a headache the next morning from drinking wine if the headache takes place in the atmosphere of, it's okay, honey. You failed. I love you. Let's learn from this and move on.
Yeah. I love that. I feel like my just like opened up, like I'm just like, oh, I'm feeling like really calm just having heard you. That's fantastic.
Yeah, I'm like,
it's not just the cure for wine drinking, it's like the cure for everything.
Exactly.
Well, love is medicine. That's why we're here. I mean, when we boil this down and all these conversations I've been having with all these amazing people, at the crux of every single conversation is being willing to show up for yourself and say, it's okay, I love you anyway.
Oh,
Period, the end. And when we can do that for ourselves, then we're not relying on our relationships to do that for us. And then our relationships heal and our, with other people, and they become less codependent or dysfunctional or kind of, I need you, you need me kind of thing. And then all of a sudden it becomes really easy to choose what to eat for lunch, because you're not bound by all these external rules. But you say, when I eat cheese, and I'll use myself as an example, my tummy doesn't feel really good, and it's just it doesn't feel loving to me. So it makes it so much easier to not want pizza or whatever. It's just easy, because it's not, oh, I can't do this and I can't have this. It's, what, when I choose from presence, I'm choosing me every time.
You've got it exactly, Nicola. Exactly. Well spoken.
Well, I know that the last thing I know you wanted to touch on was this idea of doctor as teacher. And I think as we're sitting here teaching each other and teaching you guys and teaching ourselves, I'd love to hear more about what's so important to you about this piece, because I do think in our current medical climate that has been lost quite a bit.
Yeah. It's precious to me. Doctor as teacher, because I love above all healing. I love above all healing in myself, and then pretty much equally is sharing this healing wisdom with other people. And my practice and my teaching is an opportunity to do that. And for naturopathic doctors and other holistically oriented doctors and health professionals, our practice is an opportunity for us to serve as physician teachers, teaching people how to heal themselves. And the way the course of study for a physician teacher is that directed by Hippocrates centuries ago, which is physician, heal thyself. And my course in self-healing is the first course that I offer to doctors, is the work of healing themselves. And then there's longer 6-month mentorship in teaching them how to teach their patients to do this. Mm-hmm. In my own experience, and it's like this: if I know how to dance and I ask a woman to dance, I can tell if she's better than me or not as good at me as dancing, who is more skillful. In the same way, with my patients, because of the skillfulness that I have in my own life, eating, moving, thinking, and relating, I've studied these throughout my life, I'm able to observe the skillfulness of my patient. This is my diagnosis. My diagnosis, it makes little difference to me if my patient has MS or if she has rheumatoid arthritis or colitis. What I can focus on is her behavior and the influence her behavior has on that. And so I am diagnosing not whether you have MS or something else. What I am diagnosing is the level of skillfulness with which my patients perform these behaviors. And in 2 parts. One is, how are they injuring themselves? How are they creating their illness through self-harming behavior? That's one part of the diagnosis. And then the other, the therapeutic part, is what are the healing behaviors that she must learn in order to heal herself.
Hmm.
Right? So that, and then another area of diagnosis is in my patient's ability to give themselves love and to receive their own love. How skillful are they at that? And how clearly do they understand themselves? To begin with, how clearly do they understand what they desire and fear? How clearly do they understand the motives, the desires and fears of their self-critic? Mm-hmm. Right? And in this, then, what I'm pointing to is that to the degree that I have developed some level of skill in each of these behaviors, just like dancing with a partner, I can tell, what they need to learn, right? It's the same way here. I listen to everything my patient does. I'm watching their posture. I have their eating journal there, and I discuss eating with them. I know their relationship to workouts and to exercise. I listen to them, and I hear them. I hear their fears. I hear how they criticize themselves, how the level of self-esteem that they have. I hear how they understand to relate in their relationships, and I'm assessing all of this. And then the treatment is the patient herself, beginning with she herself, her love for herself and her understanding of herself, and then bringing that love and understanding into each of her behaviors.
Mm-hmm. Mm-hmm.
Yeah.
That's beautiful.
Yeah. So hence, to circle back, this is the joy and the meaning that lies in being a physician teacher. And this also portrays the self-healing work that all physician teachers must be engaged with themselves, their own self-healing, in order to in part, I must add this, to have the same compassion for the patients that they have for themselves.
Yeah.
Right? Because we're failing all the time, and it requires great compassion to be able to continue on
Not just
in this process of repeated failure. And so it's like we're with our patients going, believe me, I know. I'm right with. I have no judgments about this.
Yeah. Well, thank you for naming that, because I do feel like we get put on pedestals and like, oh, you probably never do this and you probably never do that. I'm ashamed to tell you that I did this, and I'm like, oh, honey, I did that last week. It's and I'll probably do it again.
Then it's over. I'm going to go do it again.
Yeah. Yeah, so I think it's great to name it. We're all human and we're all working this out, and that if you've tried and failed, it's not because you're defective. There's nothing wrong with you. It's because you're on this very human path, and this is just part of it. It's not perfection. It's having that intention and that passion. That's the point, not having the outcome that looks really pretty and you can post it on Facebook and say what a great job you did.
Nicola, I admire and respect your wisdom and your caring, dear. Really, you shine with it, and I admire your bringing together this summit. Is it called a summit?
Yeah. Mm-hmm. Mm-hmm.
Yeah. It's taken so much to do this, and your love of patients and helping them through all these means, and your wisdom and skill in doing it, I greatly admire and appreciate.
Well, thank you so much. And thank you for being part of it and being willing to share your wisdom and experience and authenticity and reality, because we are all in this human experience together. And I think the more we start outing ourselves, then then the more space there is to just be who we are and be and love that no matter what, whether or not we're drinking wine. I love you anyway. So
Yeah.
perfect. Well, thank you so much. Dr. Charley Cropley will make sure that you all have access to his website. And if you want to take part in his course of self-healing, this is something he offers a couple of times a year for 2 different levels, from professionals and then for kind of patient, client, lay person. So if that's of interest to you, we'll make sure that you guys can stay connected. Thank you so much for being here. I can't wait to talk to you soon.
Likewise. Thank you so much.
Okay, bye.